Your client tells you their throat feels scratchy and their ears feel full. Not exactly alarming, but not something to ignore either. As nurses, our job isn't just to collect data, it's to interpret what those findings could mean. Is this mild irritation from oxygen or anesthesia? Dehydration from recovery? Or something that needs closer monitoring? In this episode of Beyond the Checklist, we'll look at how subtle ear, nose, and throat cues can help you form your first clinical impressions, long before anything becomes critical. Let's get right into it. This is Miss Dana Lewis, 54 years old, admitted overnight for short observation after minor outpatient hysteroscopy. Her vitals are stable, her recovery's been smooth, and she says she's feeling better today, just a little tired. During your morning assessment, she mentions a scratchy throat and a feeling of fullness in her ears. These are the kinds of subtle cues that matter. Is her throat just dry from anesthesia? Is this sinus congestion starting to build? Or could it be something more, like the early signs of an upper respiratory infection? Our goal isn't to assume, it's to interpret what these findings might be telling us and decide what deserves a closer look. You start your focused assessment with the ears and sinuses, because when a client mentions fullness or pressure, you're thinking about how that could both affect comfort and airway. On inspection, Miss Lewis's outer ears look symmetrical and intact. There's no redness or drainage. But when asked about pressure, she says it feels stuffy, especially when she swallows. You gently palpate over her frontal and maxillary sinuses. She winces slightly, saying it feels tender. These findings could point to a few things. It might just be a sinus congestion from lying flat after surgery. It could be mild fluid buildup from decreased movement and hydration. Or it could be the start of a localized infection. Our job here is to recognize that something has changed and think critically about what it most likely is and what needs to be monitored more closely. Next, you inspect Miss Lewis's throat. Her mucous membranes look slightly dry, and the back of her throat appears faintly red. Not bright, not streaked, just mildly irritated. She swallows without difficulty, but says her throat feels scratchy and that it started earlier this morning. These findings could point in a few directions. Dryness might come from mouth breathing overnight or from the low humidity of the hospital air. Mild redness could mean postnasal drainage from sinus congestion. But when you connect that to her earlier cues, sinus tenderness, ear pressure, and fatigue, it starts to build a clearer picture. You're not labeling this as an infection yet, but you're recognizing a trend. Her upper airway is showing mild irritation, and you're deciding whether this could progress or self-resolve. Now that we've gathered the cues, let's analyze what they might be telling us. Ms. Lewis has ear fullness, mild sinus tenderness, a scratchy throat, and reports feeling more tired than usual. None of these findings are severe, but together they point towards irritation somewhere along the upper airway. So, what's most likely? And what else could it be? Her redness and sinus tenderness could align with mild sinus inflammation or postnasal drainage. Her fatigue might connect to poor sleep or early viral symptoms. Her ear fullness could come from sinus pressure rather than from a true ear infection. Using the CJMM, this is the analyze cues and prioritize hypothesis stage. You're comparing what you see to what you'd expect, ruling in and ruling out possibilities based on evidence. At this point, your top hypothesis might be mild sinus irritation, but you'd still like to keep infection and dehydration on the list until more data confirms to rule them in or out. That's the difference between reacting and reasoning. Now that you've analyzed the cues and prioritized your hypothesis, the next step is to evaluate your reasoning. Based on what we've observed, mild sinus tenderness, ear fullness, and throat irritation, the most likely hypothesis is early sinus congestion or irritation, probably from dryness or mild viral process. So what do you do next? You continue to monitor. You'd reassess for changes, worsening redness, new drainage, a temperature increase, or reports of pain or pressure. If those cues appear, your hypothesis shifts. That's the beauty of clinical judgment. It's not static, it evolves as new data comes in. When you practice connecting these small details, you're strengthening your ability to recognize patterns, anticipate changes, and act with confidence. That's how you train your nurse brain. You just connected your HEENT findings to real clinical judgment, recognizing what each cue could mean and deciding which ones matter most. In the next part of the head to toe assessment, we'll move further down and look at what the respiratory system can tell us about oxygenation and perfusion. Remember, every cue is a clue, every action is a choice. That's how you train your nurse brain.